bathroom surgeons.
Hi, guys. All of my friends from Joy.
Hello.
Hi, everyone. Emily, it would be so funny if we had some people join this webinar that joined last year when you worked for us.
I know. They'd be like, wait a second. She had longer hair.
Her from facilitating all the other webinars.
I know. Well, I still am. I still consider you a colleague, pal.
Forever.
Yeah.
That will never change. Okay. Well, I am so excited for this discussion. I feel like every webinar I have, I'm obsessed with the topic because it's such a privilege for me to try to find all the experts to help answer questions that I wish I had the answers to when I was pregnant and had my first back in 2019. So thank you guys so much for being here. This is also our very first panel. So I'm so excited that people will get to answer or have any question that they need answered. And there's 100% chance one of you four will be able to answer it with, a real expert, educated answer and not just some random opinion like we got on social media. Okay, we have people joining. So if you are joining, go ahead and put in the chat. You'll see on the right-hand side a comment section. You can use that to ask us any questions at any time. If you want to let us know like where you are in your parenting journey, if this is your first baby, if you're pregnant with your first, if you're a veteran parent, caregiver, whatever, you can go ahead and let us know in the chat. Otherwise, if a question comes up during the session, please don't hesitate to ask it. And if you are already on and you are one of the attendees that submitted a question beforehand, we will definitely get that answered during our session. So, hi, Libby from Chicago. Full-time mom, 23 weeks. Congratulations.
Or first-time mom.
First-time mom, full-time mom. What'd I say?
Same thing.
First-time mom, yes. 23 weeks. Amazing. Well, welcome. We're so happy you're here. All right. I'm just going to introduce myself quickly, and then I'm going to ask if each one of you will do the same, and then we'll get right into it.
Great.
Okay, cool. For those of you that don't know, my name is Sarah Hollingsworth. I'm the founder of Poppylist, a simplified baby registry platform. I am located in Austin, Texas with my husband, Scott, and my two girls, Amelia, who will be 5 on Wednesday, and Zoe, who just turned 2 in April. So it's an honor to be here with you guys. Again, I'm so excited for this discussion. We've had a handful more people join. So if you want to let us know in the chat where you're located and where you are in your parenting journey, and any questions that you have, please don't hesitate to put them in the chat. So without further ado, I'm going to hand it off to Emily to introduce yourself, and then we'll just sort of roundtable the rest of the experts and get started.
Okay, amazing. Thanks, Sarah. I'm Emily, and welcome. We're so glad to be here. I am the head of parenting at Joy. Head of parenting, but still learning how to be my best parent self all the time. So I live in New Jersey. I have a 5-year-old son and a 3-year-old daughter. And you guys are in fabulous hands today with these three. I will maybe poke in here and there with some comments, but you'll be chatting with these experts who are part of our expert team at Joy. So Olena, do you want to go ahead and introduce yourself?
I'd be happy to, Emily. Thank you. My name is Olena Dubchansky. I'm a master's prepared registered nurse and nurse leader. I'm a lactation consultant as an IBCLC, and I am a feeding expert at Joy. So I love answering all questions. Full spectrum lactation services is what I honor, and I'm so excited to be a part of the panel today. Thank you.
Do you want me to go next?
Go ahead.
Perfect.
I am Maddie Ross. I'm a parent coach at Joy. I'm a single mom of 2 awesome little girls, 5.5 and 2.5. I live outside of Boston, and I am also studying to be a birth doula. And I just love moms and babies.
Perfect.
Can I interject? I also have 2 kids. I love it so much, but I'm so used to talking in professional spaces where I don't mention I'm a mom. So I really actually want to take a minute just to honor the fact that, yes, being a mother is a very big, important job. And I'm a mother of 2 under 2. So yeah, that's probably why I forgot. Go ahead, Heidi. Sorry about that.
2 under 2. You're allowed to forget a lot of things. Let's put it that way. I am the sleep expert at Joy. My name is Heidi Brooks. I have 4 kids. I have an 8-year-old and a 7-year-old. They're 16 months apart. Don't worry, I'm not that insane. And then I waited a little while, and then I had a set of twins, and now they're 3. Yeah, it's hard separating your mom identity from your professional identity, especially if your mom identity informed your professional identity. So
Sure.
I feel that. I get it. And sleep is super hard to come by sometimes. So that's why I'm here.
Amazing. Well, thank you guys so much for being here again. So just to sort of like set the stage for everyone, we're going to walk through this session with our experts in sort of 3 categories. So it's going to be feeding, sleep, and feeling. And we aren't going to talk much about like trying to conceive pregnancy. We are going to really dive into the first 2 weeks home with your baby, and holy heck, what is that like? What should you expect? And again, I just sort of want to reiterate, like everyone said, we are all moms. There's no question that's off limits. I think that these discussions are so important because, like I share with them for this prep call, my mom conveniently forgot most of the first several months home with the baby. I was the first of my friends and sisters to have a baby, and I was so ill prepared for myself physically at home. With a newborn, I was terrified. I needed to be extremely vulnerable and ask for help in ways I wasn't prepared for and didn't expect, beyond just with my newborn, myself included. So again, thank you guys so much for being here. So let's jump right in.
And also, just really quick,
yeah,
when you're home and in that moment, it can feel like you're the only person that's
who's ever gone through it.
or who's ever gone through it. And yes, every baby's different and every parent is different, but there are probably some things that happen to most, if not all, babies, or at least questions or things that come up. And that, I think, is the point of this, which is to say, if you have that question, probably someone else does too. So there are some things that you can know now if you're pregnant that will prepare you for, like, you'll have that moment where you're like, oh yeah, they mentioned that, like that's happening now. So that's what we're trying to do now ahead of time. And so just that, like, setting the stage there.
Absolutely. Okay. So first up, Elena, we are home from the hospital and we are home with our baby. Let's say it's day 2 or 3.
Yeah.
In terms of feeding, what are some things that you talk to your patients and clients about, and new moms, in terms of what might happen when they get home? And I have some more pointed questions that I want to ask and some that already came in, but can you just sort of help set the stage for us in terms of feeding right when we get home with our baby?
Absolutely. So I want people to think about what actually happens when you give birth, right? When the baby is inside, you've got circulatory system and you are one, and that's how you're getting fed. And how you're getting fed as a baby fetus is continuous. It's continuous, right? And so when you are no longer attached to mama's placenta and you are born, and that's what's either happening in a hospital or birth center or wherever, right? That's stopping. That continuous feeding is stopping. And so I think one of the most important expectations that we need to kind of adjust as a society is that the baby, when they're born, will essentially be expecting that continuous feeding. And this is because we are carry mammals. We want to be nest mammals. We want to be feeding our babies, 6 hours go by. We're not, right? And especially when we breastfeed, we really don't have a set schedule or a clock to look at. We really are looking at the baby. And this is, of course, going to be very challenging when someone has never had any experience with an infant.
No experience with an infant, no experience feeding. So I remember thinking through, I'm going to exclusively breastfeed. I was adamant. I was set on it. Sure enough, plans change. So what's some things that you can give advice for new moms, like in terms of a plan? How should they structure and think about a feeding plan for themselves and their baby?
So I think one of the things that I'd love to mention right now is breastfeeding. And when I think of it and I talk about it, I'm talking full spectrum. So pumping is breastfeeding. I pumped for an entire year with my son. He was unable to get to the breast, and I do this for a living, right? No one's going to tell me I didn't breastfeed for a year. So I'd first want to mention that definitionally, we have to look at this in a big picture.
Yeah.
In our society, we don't have a breastfeeding culture. We have quite the opposite of that, actually. And as a result, when we think about what our goals and dreams and aspiration for postpartum are, they often are goals, dreams, and aspirations. And that's when the reality hits and you're saying to yourself, what have I done? So I think the first thing that I'd say is flexibility. When we think about what happens in the hospital, and I'm the clinical program manager at Lenox Hill Hospital for lactation, and I see patients every day. And one of the things that I'll tell someone is every day will be different. This is one of the most important things someone needs to know in the first 2 weeks of bringing home baby. The experience in the hospital will be unique, right? When babies are first born, they're pretty tired. We call that the birthday nap. And then as the days continue, they get more and more interested in the breast or more and more interested in feeding, no matter how you do that, right? When we look at bottle feeding, if that's pumped milk or formula in a bottle, right, we need to, again, use the baby and kind of pace that bottle and use kind of a technique that will be more baby focused. Now, again, what does that mean? I've never held a baby. I've never had a baby. What does that all mean? Really, really, truly, people have never held a baby. We have to start there. Literally hold your baby, because the position, if we're talking about bringing the baby to the breast, will be unique to you. Mm-hmm. And so what will happen in the hospital or in a prenatal class is you'll get general information. And then this is the scary part. You are one of one. You and your baby will be unique in human history. And so unfortunately, we don't have a bigger society that is kind of addressing this, but things like Joy, and there's a huge movement in postpartum to really recognize this as the vulnerable piece that it is, but how effective it is for long-term health.
Yeah, and by the way, like Maddie, Heidi, Emily, if you guys have anything to add during this, you certainly can. But you know, as you're speaking and providing that information, I was thinking to myself, like, the plan I made was such like a small window in time. Like, I made a plan for just when I got home from the hospital, but I forgot about the plan for when I was going into an office environment where I would have to pump, and I didn't register for the supplies that I would need to support me for like that sort of period of time. So I always try to remind people, you know, if you are in the stage where you're building your baby registry, it really should support you 6, 12, 18, 24 months out, and Absolutely. Not to forget about all those potential scenarios.
And it's very hard as a human being with a human brain to be anticipating the future like that. And I think that is what is so unique about the emotional demands and the physical demands of early postpartum. You don't know what you're doing. Right. I do this for a living. I didn't know what I was doing when I lived it. So I think leveling with people like that, it really is true. You're going to learn your baby by being with them. And there's going to be support and help, hopefully. That's the goal, because that way you get a little level set of whether or not it's you or the situation. I deal with babies who have feeding issues. Those moms postpartum are stressed, very stressed. And unfortunately, when we go to the pediatrician, often that individual did not receive feeding therapy information. And so they will come to you and say, well, here's the plan. Give a bottle, do this, do that, right? And so often people will say, okay, well, I'll do that because the doctor or the nurse practitioner, whoever, the medical professional, whoever it is saying, and they don't know to advocate for themselves. So I think that in prenatal planning, when you're building the registry, when you're thinking about what it's going to be like to feed the baby, what are those constraints? Are you returning back to work? Are you working from home? Those are two totally different things that will require potentially different plans. And I think, again, when we think about the transition, and this is my real specialty, is the transition from the hospital to the immediate postpartum at home, you have to give yourself grace. We'll talk about some kind of tips to deal with the mental aspect of feeding, but all of this is intertwined. So sleep and feeding and feeling are all one thing. Again, when we think about someone who had a plan to exclusively breastfeed, a skilled clinician will try to find out what that means to someone, right? Because exclusive breastfeeding for a period of time, exclusive breastfeeding because you had a traumatic experience with your first child, exclusive breastfeeding, but you actually mean that you're going to do X, Y, and Z. So again, I think that prenatal period is very important, but the key in the first 2 weeks is every day will be different. When I teach feedings, I want them to be 3 E's: enjoyable, ultimately, effective, and efficient. And in the first 2 weeks, if you are breastfeeding or learning that skill, and for some babies who are bottle feeding, no matter what you're putting in there, they may need time to kind of get into the swing of things. And so as a result, every day is different. It's something that we need to really, really be graceful with in terms of giving people like the ability to know that consistency is not what you're going to get in the first 2 weeks from a feeding perspective.
I would love to jump in.
Go ahead, Patty.
I would love to jump in because as Elena's been talking, something I've been thinking about, and then we just got a question kind of around it, is that like Elena said, we're not a breastfeeding society, but I know for me and for many of my peers, I just assumed that my milk would come in and I would be able to feed my baby from my breast. And that was not the case for me. And that is not the case for many women. And I saw somebody ask, when your milk isn't flowing automatically, but you want to breastfeed, something I really struggled with was like the guilt around my body, not being able to provide for my child. And it took a lot of mental work for me to understand. I mean, you hear all the time, fed is best. And it's become a little bit of a cliche, and I'm sure Elena hears that all the time and has feelings about it. But, you know, that felt not good enough for me. And I put a lot of pressure on myself to be able to be the sole provider of my baby's nutrition, to the severe detriment of my mental health. And so I would love to just name that it does not come easy for the vast majority of women. And sometimes no matter how much you want to be that source for your child, your body is just, for many, many reasons, not gonna let that happen. And like Elena said, to give yourself grace, but to also recognize that you can bond with your baby feeding them a bottle. It's
my favorite thing Elena's ever said, which I'm sure will say, is that like your breast, I know this sounds like strange, but like your breast can still be involved if you're not breastfeeding. So like, Elena, there's this thing that you say that like I think about often, about like the point and the purpose of like what your breast provides other than just milk.
Food, water, security, shelter, love, baby. It's everything. This is the thing, right? Like it doesn't have to be everything for everyone. When we think about infant feeding, it is as unique to you as you are to your baby. So when you are building a registry, you are going to have the ability to look at lots of different products to help you meet your goals. Classes are helpful. Any kind of information that can help you switch gears. Because what I found in my personal infant feeding struggles, both of my children had tongue ties. Both of them were revised. My first did end up coming back to the breast beautifully, but the first 6 weeks were a fugue state. And again, I do this for a living. Postpartum is a wild, wild ride because you're not you. You were also born. The you that you were is now gone in a beautiful way. Okay. So again, this is information to empower, to make informed choices. If pumping is something that you didn't think you were going to do, womb north, that's definitely what I say.
I love it, womb north.
The idea here being that in the event, like me, could not get the baby on the boob. large for gestational age, sugars not keeping, hot mess, scheduled section, so never went through labor,
Yep.
right? Like these are all contributing factors for challenges at the breast, right? So I pumped and I did therapy and I did all this stuff. And did I reach my goal? I did the best I damn could.
Yeah. And I think that that's pretty much early motherhood.
Yes.
And giving ourselves a lot of grace to try and do the best we can. And if I think,
but guys, the goal
is best is what's best for us.
Shouldn't the goal not be static at this point in time? We're in 2024.
Yes.
The goal should not be static. The goal should be flexible. Not to say like everyone should be like, you know, not wishy-washy, but like situations change. You know, we are learning more every day. Like the things that, you know, were like common knowledge for your parents or even like parents 10 years ago, like everything is so fluid now. So like the goal should be fluid as well.
Right.
Absolutely.
And I see, Kira, you said that in Germany it's normal to breastfeed and everyone says it's the best to do. And for sure, the benefits of breastfeeding and babies getting breast milk are enormous. And if that isn't working for you and your baby, then it's bad. Then it's not good. So your baby is going to get what they need from formula, from breast milk. And there are other ways to get the bonding, all of the things that Elena mentioned. So if it's not working for you, then it isn't the best thing.
And in that same token, there's both sides, right? There's the help and the participation, and I'm doing everything I can. And then there's the flexibility and saying I'm switching gears. Both of these things do not exist in competition with each other. When we're talking about learning to breastfeed, no question, there was going to be a period of a piece of that, which is you and your baby. Right? Like the physical, you're learning a skill yourself. The baby is learning a skill, you are learning a skill. But I would be remiss to say that there are lactation consultants and skilled providers out there who absolutely want to help you meet your goals. And I think the key is early intervention. This is why a service like Joy on Call truly is remarkable. I've been in maternal child health for 15 years. I've been working with new families for over 20. You know, it's the early intervention. It's the saying, hey, are you okay? Right? Because moms aren't sure if they're okay. I can tell you that every day will be different. I can tell you that every day will be different, but you're not sure. And so there does need to be this skilled level of saying, hey, okay, you're on the right track, or sleep is connected to feeding. You probably didn't think about that until you're living it now, you know? And I think that that's why, again, when I work in the hospital and I work with patients outside of the hospital, these are two totally different experiences. And that early intervention, that ability to say, you know, how are we doing? Are you okay? Crucial advocacy in the postpartum.
Well, sleep and feeding are, like you mentioned, so intertwined. So Elena, thank you. And again, I'm going to shift over to the sleeping section. So anything that you guys want to add, please do. But Dr. Brooks, we have a lot of questions that came in before this session. I want to make sure we get them answered. But before I ask those, can you just help us understand, like, what can new moms expect in terms of sleep?
Right.
You know, obviously for themselves, but definitely for the baby, because they're going to go hand in hand those first few weeks at home.
So piggyback off of what Alina said, this is the first time the baby is eating, right? This is the first time the baby is sleeping, in a sense that, like, understanding sleep happening outside of the womb. Because if it were you're coming into this new experience where previously you have been rocked every second of your life. You had the perfect temperature. You didn't have any issues digesting anything. So this is your first time digesting. This is your first time sleeping. This is your first time swallowing, like in terms of like actual like sustenance, right? They're swallowing amniotic fluid and they're kind of digesting amniotic fluid, but it's so like minor in terms of like affecting their digestive tract. It's like it just went right through, right? Remember, like, do you remember the first time we went to the OB and you asked the question? I don't know if moms have ever done this. I'm like, oh, where's all the amniotic fluid coming from? And my OB is kind of like very quirky. And she's like, oh, they're pissing it out. That's all pee. They're floating in pee. And I'm like, are we serious, Dr. Simon? That's all pee? And she's like, they're drinking and peeing continuously. And I remember most parents, when they first hear that, they're so grossed out, but it's like, urine is sterile for the most part, so it's fine, right? But this is the first time they're doing all of this stuff. And then they're outside and they're feeling sensations, they're hearing sounds, loud sounds, small sounds, scratchy blanket, food that hurts as it goes through its belly. Maybe there's like, they're having trouble digesting, or there's air. There's a lot going on. And when it comes to sleep, they're like, I've never done this without support before. Why are you expecting? It's like, what is this? Like, it's my first 2 days. Like, you know what I mean? I'm trying to figure this out. And then the only prep the parent gets on that side is, you're never going to sleep again. Like, that's literally all you hear. And it's like, can you elaborate on that?
Enjoy it while you can.
Enjoy it while you can. It's like, it's so threatening.
It's
honestly.
so rude. It's so rude. Oh, and the hospital's not better, girl.
No, I know that.
Right.
I remember because my first son was 32 weeks when he was born. He was only 4 pounds. And I remember in the NICU, they were like, go home because this is your last chance to sleep. And I was an absolute lunatic. And it was 3 o'clock in the morning. And David would be rolling up, dropping me off, going to park the car. And I'd be hobbling up to the NICU. And I'd walk in at 3 a.m. They're like, what are you doing here? And I was just like, I'm feeding the baby. Because I remember like the emphasis was that he needs breast milk, but go home and sleep. And like, it just was the advice was complete, So
Lord.
When he got home, like he went from womb to isolate to home, and it was like such a transitionary period for him.
Yeah.
And then he was held for 6 months straight because I'm the oldest of 6 and I have 5 sisters and he's the first grandchild and he was an IVF baby. The kid's feet didn't touch the floor for I think a solid 2 years between everybody in the house. So the first 2 years of sleep was wild because, he never had to do independent sleep. So I think for most parents walking into it, you have all like the scary, you're never going to sleep again, but like kind of give yourself grace when we're talking about lactation and learning how to feed, give yourself and give the baby a little bit of grace in this 2-week period because they're learning how to do it. You're learning how to do it. I mean, guys, listen, not to get dark. There's a reason sleep is used as a form of torture. Like it will really drag you down and bring out the worst part of yourself and your partner. Like there are things that I remember me and David yelling at each other in like at 2 o'clock in the morning across the room. And like, we're whisper yelling, hateful things, holding a 4-pound baby. And it's like, listen, there's bouncing back from that. Don't worry. We have 3 other kids. We're fine. But like, do you know what I mean? Like it really is like, it is a type of mental terrorism in a sense.
Right. For a baby in the first 2 weeks, can you just walk through like,
yes,
what sleep looks like? Are they sleeping all the time? Are they sleeping during the day? Are they awake at night? Like what is, obviously it's different for each child, but like, is there something parents can expect for those first 2 weeks regarding like sleep patterns for the baby?
So here's the thing. There is and there isn't a pattern, right? One thing that I like to tell people is that at this age, 2 weeks into a couple months, and I think you guys see me when we talk in the chat, their brain there's no circadian rhythm developed, right? So they're not going to have kind of like these set schedules of what's day, what's night, what's going on. So the only cue that they really have for their brain to start producing melatonin and start the going to sleep process is they need things that will let them know that it's night, right? It's very primitive if you think about it. Our brains are still super primitive. So what I tell parents is, hey, what we need to do is we need to bring everything down, stimulation down, light down, sound down. And because we're kind of giving them nonverbal cues, it's time to go to sleep and we need to calm their brain and their body down. How do we do that? We make it dark. If you want to use a sound machine, I know some parents are like into it and some parents aren't. Low sound machine, we want to keep the decibels like at a decent rate, and away from the crib. We don't want the sound machine like right here because that's stimulation, right? You want to make them feel comfortable. They want to be dry. So fresh diaper, snuggled up in jams, and they're, warm. They're not too hot. And we could talk about like perfect temperatures and things like that. But every kid's going to be different. But every kid across the board needs less stimulation for the melatonin production in the brain to kick in to fall asleep. And you can't fall asleep if you're hungry. You can't fall asleep if you're wet. You can't fall asleep if you're in a room with strobe lights. That's my favorite too. because that was something I didn't even think of with my
Yeah,
first.
like some of those sound machines have like the lights that they
Yes.
can put displays up on the ceiling.
Listen, I love that for when like they're older and they need like some kind of like downtime, like distraction, especially
Right.
like if you're working on independent sleep. But in the first 2 weeks, you want to replicate the womb because that's where they were most comfortable. They were sleeping without issue in the womb. You remember because they weren't moving, and then you called the doctor and you said, "My baby's not moving." No, your baby was sleeping.
Well, and that's actually a question we
Yes.
get a lot at Joy, Heidi, and you know, because you answer them, is like, my baby's sleeping beautifully in my arms. And I'm sure parents, if you're a second time parent, maybe this happened to you, or maybe just, again, remember this moment when you're a week home from the hospital. My baby's sleeping perfectly in my arms, and then I put them down in the bassinet and they wake up and cry. Is that normal? Is that what we should expect? Is there anything wrong with just holding your baby while they sleep? Like, I think just these tactical tips for parents with the sleep is really useful.
So my favorite advice to give parents when, and Emily, you've seen this, they're like, every time I put them down, they wake up. Every time I put them down, they start crying. And because they're not used to being put down. They were literally free floating for so long. And I tell parents, like, I use something, it's called grounding, right? So you have to think of a baby when it's in the womb, especially like the last couple of weeks, right? As Olena said, full-term babies sleep more in the womb. That's like, they're good at it. They know how to sleep. It's just the environment has changed. So when they're in the womb, like their feet are touching, you know, especially if you're pregnant right now. And remember, you get like, you know, the lightning feeling down there because they're kicking up and they're pushing forward. Or if they're flipped, their feet are smashing into your lungs. Like they feel some kind of support when they're in the womb. And so when we have a newborn baby and they're falling asleep beautifully in your arms, because yes, they're used to being held, they felt held the whole time. And then you put them back, where are they hitting first? Their back, their whole back right away, right? And so of course they're going to be like, what's this? And it's going to be a temperature difference, a sensational difference. The mattresses are firm. It's not soft and squishy like the placenta or the womb walls, right? So what we do is we tell them, hey, you got to ground them. Give their feet somewhere to go. So you're going to put them down kind of at an angle, right? I wish I had my baby. It's upstairs, my baby doll. So you're going to take their feet and you're going to kind of let it hit.
Somebody has one.
Let's do this together. So the feet, you're going to hold her baby. Look, watch Alina. She's going to hold her baby. And here's the wall of the bassinet. You're going to place the feet at the wall of the bassinet. You're going to let them touch, right? And then you're going to let the butt hit. Then you're going to let the back hit. Then you're going to let the head hit. It's called the wave. It's like the baby wave, like feet, butt, back, head.
Because I'm doing it opposit in the camera. So I'm going the opposite way. Okay.
Guys,
so
I missed that week of 4th grade where we did like left and right and all this kind of stuff. I had strep that week. So my left and right
bassinet, and then the rest of the body goes down like a wave.
You're going to do feet, butt, back, head. And it's like, it's a wave of the body down.
So it's like a gradual putting down as opposed to just dropping the baby in the bassinet.
So because most parents are like, they want to put the baby in and they just place them on their back. I see a lot of parents are like, well, I do the side and roll. Side and roll could work. It might be fine. But if you have a super sensitive baby who's like, my side, then my back, what's going on here? Where am I? Who am I? You know what I mean? So it's like, it's a lot. So doing things, keeping in mind the first 2 weeks that this is all new for them, but they know how to sleep. It's just the environmental changes is super helpful because like you got to put yourself in the baby's shoes.
Right.
While you are all sleep deprived. So like, I'm always super sympathetic to the parents being, you know, in this kind of like really, it's a tense state to be in, but working with your baby and meeting your baby halfway when it comes to sleep goes miles.
So speaking of environmental changes, we have a question from Libby. She said, I've seen sunlight in the AM is helpful to start to regulate their circadian rhythm. I'm just nervous to do it in the first month or two in Chicago. And then once she gets used to the sun every morning, winter comes and it isn't a thing anymore. Do you think sunlight is still helpful with sleep early on?
So when it comes to sleep is interesting. Vitamin D and magnesium are two of like the major mineral and chemical components when we talk about like brain development and neurons kind of being primed for sleep, right? How do we get that? Especially in an infant, we're talking about sunlight, and some babies do like the supplement things and things like that. They're having breast milk. There's magnesium in your breast milk already or preset in your formula. So that's not something like we look for, but in the first like 4 months, there is no circadian rhythm, right? So you're kind of working with two things. You want to work with wake windows because if they get overtired, their brain starts to produce cortisol and adrenaline, and then that's not receptive to sleep. And the other thing is, you know, the darkness really in a room is one of the only things that's going to signal to their brain to naturally produce melatonin. Once they're 4 months old and like that circadian rhythm kicks into gear, and sometimes it'll happen early, a little bit early, but like I've seen babies like sometimes it's like 5 months and they're like, they still kind of don't know the difference between day or night without you telling them, hey, you've been up for a really long time, or hey, you look a little sleepy, and showing like the cues and stuff like that. And you put them down, you make the decision for them. But their brain
sleep is not important. I mean, sorry.
so
Sunlight is not the most important thing early on.
I see a lot of the comments of keep it light during the naps and whatever, but again, their brain's not going to produce the melatonin in the light. And I understand the concern, like, oh, it's going to be winter soon, it's going to be darker soon. It just depends on how old they are. But as a newborn, they need the darkness for their brain to produce it, the melatonin.
Right.
And Sarah, I was going to say, in the post-webinar email that I know you're going to send out, we'll put a couple of PDFs. One is a wake windows chart for the first few weeks. So you'll understand, like, after this amount of time, it's time to start to think about a nap. And so we'll make sure that everyone on the call gets that.
Okay, great. Thank you.
I was just going to mention that related to feeding, breast milk has a melatonin precursor component to it. So a question I actually get very often is, because moms, the patient population that I work with often are pumping very soon. They're going back to work very, very quickly. And as a result, they use the pitcher method. It means you're combining all of your breast milk essentially together. And so people say, what about the day milk? What about the night milk? What about the real answer is we don't have enough data to really be research to really be able to tell you definitively that the melatonin milk should be separate from day milk. But it is a question that is often kind of coming up as sleep and feeding are related.
Right. And like to Alina's point, also, like we're both in New York, by the way. So we are the cold brew crowd. And so we have a lot of moms who are like, can I have, how many cold brews can I have? And we're like, hey man, listen, we're not going to have like 6 cold brews across the day. Cause like for your heart, that's not a great idea. Some caffeine does get into the breast milk. I had a mom who drank 3 or 4 cold brews a day, like across the day. Like, listen, she's tough. I couldn't do it. It couldn't be me. But she was like, I stopped having my cold brew at 3 o'clock. My third cold brew at 3 o'clock, and I felt like they went down easier for naps because she had twins. And I was like, I mean, that might be it. That's a lot of caffeine. That might be it.
Well, caffeine is a question we get a lot about with breastfeeding and sleep. So that is useful.
Cool. We talked about that last Friday in a webinar.
Oh, good.
So we only have like 8 minutes left. These webinars tend to fly by. So I want to just transition really quick. We are at home the first few weeks, learning a new feeding rhythm, trying to establish what is working best for both the mom and the baby and our partners. We are trying to sort out sleep, getting it while we can, understanding that there's no actual circadian rhythm in the babies until they're 4 months, etc. We are hormonal, sleep deprived, hungry, scared, joyful, all of these things. Maddie, can you help sort of like articulate what this might feel like for a new mom when she's at home?
I sure can. And the feeling is wild. It's something you have never experienced before. And even if it's your second baby, you still haven't experienced it before because it's a brand new baby. In the first 2 weeks, your hormones are fluctuating so immensely that it affects every part of your being. And a huge part that it affects is your feelings and your mood. Many women experience the baby blues, and that is the result of hormones. So in the first 2 weeks, I would say probably most moms experience the baby blues. Yeah. They worry that perhaps it's postpartum depression or anxiety, but then they see after those 2 to 3 weeks kind of the veil lifting, but you're gonna feel a lot of feelings. You might not feel immediately bonded with your baby. You might feel so fiercely bonded with your baby that it makes you anxious. You don't even want your partner to touch them. What I like to tell new moms is that any feeling you have during those first 2 weeks is a normal feeling, even if it's really extreme and it might be scary and it might be something that you do want to seek help for and get resources for. moms before you have experienced it.
Many moms.
So again, kind of like letting go of that guilt, of that expectation, and just talk about a wave. Just riding that wave and saying, okay, in a couple days, I might feel differently. In a couple hours, I might feel differently.
Yes, everything's temporary.
Everything's temporary. Asking for help when you need it, whether it's I need help changing the baby's diaper, I need help giving a bath, or I need help not hysterically crying right now. Support me in my hysteria.
Yeah.
The baby comes first, but mom is right there. And if mom isn't getting what she needs emotionally or from like a feelings perspective, that makes it harder for her to be a great mom. And then it impacts the baby. So recognizing that those first 2 weeks are so crazy and giving yourself that grace is where you want to be.
Yeah. Yep. Emily, you're muted.
Oh, really?
Sorry, Melanie. I remember going to CVS to like pick up a prescription, and it was like being on a vacation. Like
100%.
The 2 minutes, right? So like find those little moments, even if it's a drive around the block, and let yourself just exhale a little bit.
Yeah. So go ahead, Alana.
I was just going to say, I outwardly am a very emotional person. I essentially cry all the time. I can't help it. These lacrimal ducts just go. But the reality of the situation is emotions are temporary.
Right.
You are going to feel, guarantee, a range of emotions. The thing is that these things are temporary. So if they're not temporary, which I think is where Maddie was definitely going to go with this, right? That baby blues is not really the baby blues anymore, or a plan is not working, right? That advocacy and the ability to say, I need to change gears, or say to myself, I'm no longer feeling a temporary feeling. I'm in a state of what? Rage, emotion, depression, anxiety, whatever it is, right? And those are
one of the questions that we got in the chat that I would love to address is a question about rage during the night.
Yep.
Sarah, do we have time to go over that real quick? I know we
don't. Sure. The question was how to prevent anger due to lack of sleep and not let it affect connecting with my baby.
There's no preventing it. So you are going to have those feelings, and those feelings are totally normal. Like Heidi said before, sleep is used as a torture method because it impacts your mental health greatly. It works. When you're not getting sleep, you're going crazy. So recognizing that those feelings are going to come up, and many people I know have the rule during the night that like all bets are off during the night. If anything, I say anything mean, it's canceled out by the morning, because that stuff comes up. And I can't recommend enough finding a way to split the nights up so each partner is getting at least a few hours of sleep. Of course, it's more difficult if you're feeding at the breast, but we can share resources on that. And the joke is sleep when the baby sleeps, but if you're not a napper, try and get that sleep anywhere you can, because there's no preventing that anger, and recognizing that it's going to come up, it's going to happen, and giving yourself that like, okay, wow, I'm experiencing this rage right now. I'm experiencing this anger. It doesn't mean I hate my partner. It means my hormones are cranking.
Absolutely. If Libby's still on the line, it just occurred to me that I want to tell you, even if the sunlight isn't super helpful for your baby in the first,
it's helpful for you.
Yes, I was going to say, Libby, you take it. You get outside and sit in the sun and take advantage of it before it gets dark and gloomy in Chicago.
Listen, do you remember how happy the Jersey Shore cast was? Because it was Gym Tan Laundry. That was it was a prime time of life, guys. Come on, remember that?
Sarah, do we have a moment to answer Catherine's question on siblings quickly?
Yeah.
Okay, so really
and you
fast.
Have an article that we can send her.
We have a couple, or actually we have 2 articles, and we have a call we recorded at Joy that I'll send to you. It's just a link, and you can watch all about sibling interactions and sibling introductions. What I would say, Catherine, I assume you're pregnant with your second and the baby hasn't come yet. So this is actually a great time to ask these questions. We can have a whole webinar on this, Sarah. I think the preparation is important. I wouldn't prepare your older child, especially because they're 23 months. They're not 3-4 years old too far in advance, right? You're gonna tell them, oh, you notice mommy's body's changing. Mommy has a baby in her uterus. The baby's going to come out soon. Use real language and real clear words to tell your child what to expect. Give your child a doll so your child can nurse the baby while you're nursing your actual new baby. And then the other quick tip I'll give is that when the baby comes home physically, right? You're bringing the baby home from the hospital, your older child is there. You're going to want to greet your older child first. You're going to want to rejoin with your family that was there before the baby came to establish that I'm still here. I'm still your mom. We're still a family. And I would not walk in holding the baby. I would put the baby in a safe car seat or have somebody else hold the baby, greet your older child, hold them, remind them we're so happy you're here, and follow their lead. If they want to see the baby, great. If they don't, that's okay. They will. It'll all happen. But don't let your excitement spill over to your older child because they may just be confused, tired, they missed you, whatever. Yeah. So I would just make sure, follow your child. I know this is a very fast explanation, but reconnect, and then you can bring that new baby.
Yeah, and we'll send those articles. And I want to reiterate your point about not holding the newborn when you introduce them to their older sibling. We also followed your lead on that one, and I think it was one of the most important things we did. There wasn't this instant feeling of like jealousy or confusion, and we followed Amelia's lead. And also make sure someone's filming that interaction for you. I think it's gonna be one of the most beautiful moments you've ever experienced, and you're gonna want to capture that. So you don't do it, not your partner. Like if there's a third person there, or if it is your partner, to make sure someone's capturing that moment for you.
Yeah.
Okay, last question before we conclude. Elena, I'm gonna ask you this question. Where did it go?
Was it about pumping overnight?
Yes. Where'd that go?
I saw it. So in the first 2 weeks of life, again, there is going to be a physiological change from your pregnant state, right? So you're no longer pregnant, you're postpartum. What does this mean? From a breast milk production perspective, I try to get away from the idea of supply. Supply makes it sound like you've got a library full of books, you can take whatever book off the shelf, la da da. That's not what it is. It's production. So think Lucy and Ethel with the chocolates. When you take more chocolates off of the assembly line, more come down the list because it's kind of saying, okay, you're keeping up with this production. You can increase how quickly it comes out. This is the nature of breastfeeding, plain and simple, okay? If milk expression is effective and efficient, your baby might not be, and your pump can be, but through help, okay? Because that is a whole nother webinar. If that is an effective and efficient way to remove milk, right? Overnight, you will make more milk. It is a nocturnal process in the beginning. We don't really know why. Perhaps there's an evolutionary perspective, but between 12 midnight and 4 a.m., prolactin surges. So work smarter, not harder. You biohack the situation. If your goal is to produce more milk, you will have to stimulate and remove milk in this period of time. I am all about the protected sleep window, 110%. I dealt terribly with sleep deprivation with both of my children. It's something you don't really forget. As a result, protect the window, but understand that, again, hormonally speaking, you're going to be making more milk during certain periods of time. When you are between 5 and 8 p.m., you are a little bit drier. There is a natural rhythm to the breastfeeding amount of milk that is made. So as a result, what happens between 5 and 8, baby gets fussy. No, protest. I'm angry. What's going on? And it's often called a fussy time. Let's call it a fussy time because the baby is like, what's going on? Why is there a change? I want you. Hello, hello, hello. And so if you try pumping during that time, you're only adding to frustrations, but often people do that because they want to get ready for the night. What does the night mean? I think you've got to kind of think about that expectation as well, right? Are you going to sleep at 11 o'clock? Are you going to sleep at 7 o'clock? Are you trying to go to sleep at midnight, right? And as a result, when we use a 4-hour window to not pump and use that as a way to protect sleep, next feeding, either putting the baby on the breast or you're removing milk, and you will have output. It's all about that stimulation and appropriate milk removal so you make that production. Hope that was clear.
I think it was. Thank you. And extremely thorough. So I feel like we have now uncovered several topics that we can cover for the second half of the year. Emily, I feel like we're going to need you guys back on the schedule for the rest of the year.
We're ready.
We'll be here.
Guys. Yes. Maddie, I feel like we didn't even get to cover a lot of the feelings.
I know. I love
it. We need an entire webinar on the high achieving mom. Like I wanted to get to like the classic bait and switch. Like there's so many amazing.
And your body and your vagina postpartum.
So I will sort of like end it with just two quick things. There's still a handful and tons of people on the line. Thank you guys for your vulnerability. Thank you for answering these questions honestly. Thank you for submitting such wonderful questions. Motherhood is really wonderful, but those first 2 weeks are extremely terrifying for multiple different ways. I've told Emily this story, but I'll never forget. I think it was like day 5. I was home with my kids. I was home with Amelia. She was my first. And I felt like my body had been hit by a train after that delivery. And the toilet paper, I was going to the restroom. The toilet paper was behind me on a shelf and I couldn't reach it. And I just remember hysterically crying because I couldn't believe that I was going to have to ask for help to hand me the toilet paper. But truly, like you just find yourselves in these extremely vulnerable situations that otherwise you can always do for yourself.
Right.
And
that are not funny in the moment, right?
I'll never forget that moment. No, I was hysterical. It wasn't funny. I'm bleeding. I'm hurting. I can't reach the toilet paper. So I say all that just to know, like, it's going to be a really hard, vulnerable time, but you cannot be afraid to ask for help from anyone that offers it. Please take it. And the other thing I just want to make sure we touch on, and we can talk about this in other sessions, is your hormones are going to fluctuate for months. I did not start to experience postpartum depression and anxiety until month 6. So just please pay attention to how you're feeling for months, even a year or longer after that. If you can if you can educate your partner on what to look for, sometimes they will see it in you before you see it in yourself. That was our case. So just know there's people that want to have your best interests in mind. They will be there for you. Let them. And we will send out the next 100 webinars for the rest of the year with our experts from Joy. Yes, can we share the Dear Woman resource? Yeah, we'll put it in the email. Make sure Emily has it and we can get it in the email.
Yeah, we'll put all of our email addresses. If you want to contact us directly, we'll put joy.co, which is how you could join Joy again now or once you deliver. And we'll give you several resources, mostly PDF downloads to just check out and have on hand. So amazing. Sarah, you get that out in the next day or so, right? Usually?
Yeah, usually it's the same day, but not that anyone cares. I have like a long training day for that hike I'm preparing for. So I have to leave in like an hour.
We'll do it tomorrow.
So I'll get this out on Monday morning.
Perfect. Okay. Thank you so much for having us.
Thanks, you guys.
Thanks, everyone.
Bye, everybody.
Bye.
Happy Friday.